We've talked at length about how to recognize and respond to students that may have a substance use problem. But how should you respond if you suspect student's family member has a problem? In this video, school staff will learn the actions they can and can't take if they suspect or have an awareness of family or caregiver substance misuse or substance use disorder. We'll discuss utilizing a student assistance program team in these cases, as well as strategies to help students with the stigma and shame they may experience when a family member is struggling. School staff regularly learn all kinds of information about students and their families. Sometimes they may become aware of a substance misuse issue for a caregiver or other family member. It is essential that staff maintain healthy boundaries when communicating about these issues by staying focused on the facts and avoiding gossip or assumptions. Caregiver substance use disorders can significantly increase risks for youth, but do not always indicate the presence of child abuse. Anytime the facts indicate a child safety concern, mandated reporter guidelines are in place to help ensure student safety. In these instances, school staff need to notify Childline to communicate all safety concerns in as detailed and factual way as possible. Unfortunately, sometimes school staff may suspect a problem without knowing the facts. In these instances, it is essential to maintain a close relationship with the youth and enlist the help of the Student Assistance Program or other pupil services personnel to provide support and further assessment. These professionals can help clarify facts and gather more information about suspicions, and then reach out to parents or caregivers to refer family members for assessment or other services if warranted. Emphasizing to students and families that substance use disorders can happen to anyone, that help is available and effective, and that the school is there as a protective support for the student can decrease the stigma and shame that often prevent people from getting the help that they need. Providing information to all students about how to get help for themselves or their loved ones, and teaching them about the need for professional assessment, treatment, and the chronic nature of substance use disorders can help them prepare for the treatment process. This Department of Drug and Alcohol Programs website is a great resource to share with families and students. To recap, school staff can protect students by avoiding gossiping or making assumptions, and by acting on the facts to report safety concerns properly. Staff can increase the likelihood that students and their families will get help by flagging concerns or suspicions to the Student Assistance Program team or other student services personnel, and maintaining relationships with students who seem to be at risk. Finally, staff can combat stigma and shame by teaching students that anyone can develop a substance use disorder and educating students about effective treatment options.